So at this stage, I wanted to show you an example of a typical neck exam for a patient who came in. Again, we'd be going through some ranges of motion to not only check for flexibility, but also to see what reproduced the pain. And then I'm going to be combining motions so that I stress various tissues, joints in particular, different portions of the spine, and again, getting sort of a mental record of what's reproducing the pain so we can correlate that with the consultation. So we'd start off this by doing a range of motion examination. Claudia, if you bring your head down all the way, and she'd be telling me if she had any pain with that and pointing to the area of pain, and then bring your head back. So again, I'm looking, can she make this movement fully? And then we're going to turn, so we combine some motions, because we know, for example, with extension, you're compressing the joints, and by turning with compression, you're compressing those joints even more. Slightly to the left, and we're going to combine some rotation and then some extension again. These are really nice tests for not only joint or facet problems, but particularly pinched nerves in the neck. Are really reproduced fairly well with these maneuvers. And then we do some compression testing where we're compressing, and here we're not expecting there to be any pain. If it's just a muscle or ligament issue, this is more correlated with disc and joint related tests. And then we'd be doing combined motions and compression. This one real sensitive with joint conditions and pinched nerves in the neck. Oh, and head back a little. There you go. And that's pretty much it for the sitting portion of this exam. And then we could be going to a lying face up position. So Claudia, you're going to lie on your back, your other back. And at this point, we'll be doing primarily palpation of the spine and seeing what reproduces the pain. So I'm going to check, first of all, pressure over the spine. So we're going to go to different vertebrae in the spine, putting pressure and just seeing, she'd be normally telling me at this point whether she feels pain at any of these areas. And again, I take a mental note as to where and what vertebra is reproducing the pain. And I check some of the musculature of the neck to see, is it hypertonic, is it spasmed or tight, is it protecting anything, or is it pain producing? So we want to check side to side, and all these various muscles up at the base of the skull, particularly when it comes to neck pain that results in headaches. Or some people just get plain headaches and not all that much neck pain, but it can be coming from the neck. So this occipital, or the base of the skull, the musculature in that area, and in particular the first couple of vertebrae are real critical. And then we want to not only palpate in a static position, but we'll want to do some motion and some compression in that area. I want to see how's the joint moving when I put pressure into it. Similar to the spring test that we used in the back, where I'm putting pressure, kind of creating a force and seeing if the spine's absorbing that force and kind of bouncing back. So we'd be doing that by going back and forth. And I'm going to different levels of the spine, putting pressure. Sometimes I'll rotate even more, put a little bit of more of a rotation, sometimes straight lateral like this, going back and forth at each segment. And I'm seeing not only is it moving properly, but also are any of these levels causing pain. So she'd be giving me feedback, and then we do the same thing on the opposite side, and the idea being we want to see, again, imbalances, because that's really important when it comes to a musculoskeletal evaluation. Is there a restriction on one side and not the other? Is there muscle tension in one side and not the other? Again, it gives us kind of an understanding of not so much what the diagnosis is going to be, but trying to figure out why a person's having that pain. So we know what to do, not only to get them out of pain, but to keep them out of pain later. So then she'd be going on her stomach. And whenever we examine a neck, for example, we're checking other things. We're checking that the patient has normal leg length as well, even though that's far away from here, because everything starts at the feet. Somebody's walking around with one leg shorter than the other. That's going to have an effect not only on the knees and the hips and the low back, but even up into the neck region. So again, we're trying to find anything that we can work to correct in the long run to keep the patient out of pain once we resolve that. So again, we'd be checking various areas, and you know, if I suspect any correlation with back pain, I'd be checking that area, but assuming that we're staying up and through this area, pressure over the spine at these different segments, I'd be doing it slower and seeing if it was pain producing. We'd be checking on the various vertebra, the side, and then putting a little bit of stress over each of these segments. Not only seeing whether it's pain producing, but again, seeing if it has a certain give to it or feels really stuck and just not moving. And then we want to check the surrounding musculature. We check and come into, for example, the upper trap muscles and here, and just below that, levator scapula muscle, and then some of the rhomboid muscles, the muscles that kind of hold your shoulder blade flat to your rib cage. And we'd want to see if any of this was tender, whether it was tight, whether there were any knots in the muscle called trigger points. And then we'd be doing the same thing on the opposite side, again looking for imbalance. And you can bring this back here. And then it's real important that the patient is relaxed and they're not tensing their muscles, which is sometimes hard when they're in pain. So again, we may be checking for other things like leg length, but for the most part, that's a typical neck and upper back exam. And that should be it.